From my first year of university, I worked at a camp for disabled kids in Saskatchewan, Camp Easter Seal. And it was a formative experience in my life in many ways. And from that moment on, I knew I wanted to do pediatrics. Pediatric rheumatology is roughly a field which deals with children who have chronic inflammatory disease. 35 years ago, there were about perhaps 20 people in the world who did pediatric rheumatology, and none doing it on a full-time basis in Canada. The diseases encompassed in the category pediatric rheumatology are characterized by inflammation, usually of joints, skin, blood vessels, muscles, and they tend to be chronic. That is, they tend not to go away in 2 days or 2 weeks. They tend to last for months or sometimes even years, and often involve multiple systems. Fortunately, the level of understanding of these diseases in the general medical community is getting better and better. So we see the kids earlier and earlier, and that's of utmost importance in preventing damage and in getting control of the disease. And we can very often, usually, control these diseases with early recognition, early intervention, and very directed therapy. The causes, probably multiple, are unknown. There have been years of research gone into trying to find the causes of any of the rheumatic diseases, whether of childhood or adulthood, and with very few exceptions, Lyme disease being the most notable exception, we have not found causes. It's quite possible, however, that one could control this disease perfectly to the point of cure without knowing the cause, if one can understand the mechanism. We know almost nothing about rheumatic diseases in children in Asia, Africa, even South America. And my challenge for the next decade is to help the development of knowledge about children in the developing world. They face odds that we have no idea of. I've never had a day when I can say I didn't learn something, and I've never had a day when I can say, gee, I didn't enjoy that. I enjoy every day of my work.